Okay, we're looking at the lower leg. So here's the foot. Here's the calcaneal bone. This is posterior compartment. So we see the gastrocnemius. This happens to be the lateral head of the gastrocnemius. Here's the soleus, which is just deep to the gastrocnemius. And you can see both the gastroc and the soleus share that insertion site, the Achilles tendon, right here. Both gastroc and soleus, they are ankle plantar flexors. Now here's the Peroneus longus and Peroneus brevis. These are the, looks like the feathers, right? The two feathers here along the lateral leg. They're either referred to as fibularis longus and fibularis brevis, or Peroneus longus and Peroneus brevis. So Peroneus longus is the one that's superficial. Peroneus brevis, we could see on both sides of it, here and here, but Peroneus longus is the one that's more superficial, right up the center. On both sides of that feather is the Peroneus brevis. These are on the outside of the ankle. They're responsible for everting the foot eversion. Foot eversion. In the front of the foot is the extensor digitorum longus. So these tendons here that we see on the top of the foot, anything on the top of the foot is going to be extending the toes. So these are the extensor digitorum longus tendons right here. Let's look in the front. Now, in the front of the foot, these are dorsiflexors of the foot. Anything that's in front of the leg that's going to cross the foot has to dorsiflex the foot, or it's going to extend the toes. So the large muscle here on the medial side is the tibialis anterior. Tibialis anterior is your primary foot dorsiflexor or ankle dorsiflexion and foot inversion. Tibialis anterior is a foot inverter and dorsiflexor. Foot inversion and dorsiflexion. So make sure you watch the videos on what the actions look like. It's a foot dorsiflexor and inverter. That's the tibialis anterior. Okay, kind of goes on this oblique angle. Here's the extensor digitorum, right in the center. So those tendons here are extensor digitorum. It goes to toes 2, 3, 4, and 5. And on the outside here, you can see the Peroneus, a little bit of Peroneus longus. But if we're really going to isolate this, I'm going to ask it looking at the leg from the lateral side. From the anterior compartment, tibialis anterior and extensor digitorum longus. Okay, now here's the posterior leg. And what's cut away right here is part of the gastrocnemius. So the medial head of the gastrocnemius is removed. With the medial head of the gastrocnemius removed, it gives you a really nice view of this large soleus muscle. This is the belly of the soleus. And it does expose this tendon called the plantaris. This belly is right here, the belly, but here's a tendon called the plantaris. Plantaris is a synergistic muscle to the gastrocs and the soleus. It is a ankle plantar flexor, ankle plantar flexion. So yeah, the plantaris, the soleus, and the gastrocnemius. Make sure you differentiate between the lateral head and the medial head of the gastrocnemius. And again, you have to be able to look at your perspective and see, all right, are we looking on the medial malleolus side or the lateral malleolus side? Are we looking at the great toe side or the pinky toe side? And that helps you differentiate. Okay, now, what does the leg look like with the gastrocnemius and the soleus completely dissected away? Well, now we're looking at this. And what I want to point out is that there's a posterior knee muscle called the popliteus right here. And the popliteus, we call it the key that unlocks the knee. It's the key that unlocks the knee. It's the key that unlocks the knee because in order for the knee to flex, it has to unlock. It has to medially rotate first. Okay, in order for the knee to flex, it has to unlock. So the popliteus, if you look at the diagonal of these fibers, the popliteus is the key that unlocks the knee. It actually initiates knee flexion by medially rotating the tibia first. It initiates knee flexion by medially rotating the tibia. It kind of unlocks it. It's an unlocking mechanism. Okay, on the posterior leg, we have the tibialis posterior right here, flexor hallucis longus, and flexor digitorum longus. Okay, these muscles, as we look at them, they're on the posterior leg, and then they converge. They kind of move medially, right behind the medial malleolus. They go just behind the medial malleolus, and they go underneath the foot. Okay, and they all help to maintain that arch of the foot. They're posterior calf muscles. They're deep. They go behind the medial malleolus, go underneath that arch of the foot. So as you're standing, these muscles are pulling upward to maintain the arch of the foot. And of course, you know, flexor hallucis is going to flex the great toe. Flexor digitorum longus is going to flex the toes 2, 3, 4, and 5. So this gives you a little bit of perspective as to what does the leg look like deep to the gastrocs and the soleus. Everyone knows what it looks like with everything attached, like this. Here's the gastroc and the soleus, but when this is all cut, that's where we could see the tibialis posterior. That's where we see these deeper muscles here. Okay.